Stark. I'm delighted to have the opportunity to testify on reforming Medicare through a premium support model. Medicare is a hugely successful program that has dramatically increased the availability of health care to seniors, increased the length and quality of life of older Americans, and greatly reduced their fear of being unable to afford care when they need it. We need to preserve Medicare's guarantee of affordable health care for older and disabled people and make sure the program is sustainable as the number of beneficiaries explodes and upward pressure on health care costs continues. Medicare reform is not just about Medicare. Medicare plays a crucial role in two of the most daunting challenges facing American policymakers: the relentless increase in the proportion of total spending that Americans collectively devote to health care, and the unsustainable projected increase in publicly held federal debt. Medicare reform represents an opportunity to turn this large publicly funded program into the leader in increasing efficiency of health care and of health care delivery for all Americans. I believe that a well-crafted bipartisan bill that introduces a premium support model while preserving traditional Medicare can help achieve these goals. I'll focus my remarks on the plan that former Senator Pete Domenici and I devised at the Bipartisan Policy Center, but it is very similar to the plan offered by Chairman Paul Ryan and Senator Ron Wyden. Our proposal would preserve traditional Medicare as the default option for all seniors permanently. It would also offer seniors the opportunity to choose among comprehensive private health plans offered on a regulated exchange. These plans would be required to cover benefits with at least the same actuarial value as traditional Medicare, and would have to accept all applicants and would receive a risk-adjusted annual payment based on the age and health status of their beneficiaries. The regional exchanges would collect and manage the prices and terms of competing plans within a designated region. And those plans would include traditional fee-for-service Medicare as well as qualified private plans. The government's contribution would be set by the second lowest plan in the region, subject to their having a sufficient capacity. With more accessible information about costs and patient outcomes, cost-conscious consumer choice will lead the providers to emphasize preventive measures, managed care coordination of people with multiple chronic diseases, and adopt more cost-effective approaches to the delivery of care. However, we don't know in advance what consumer-driven competition will do. So we have introduced, as a fail-safe, which we doubt will be necessary, a cap on per enrollee government premium contribution over time at the rate of growth of per capita GDP, plus 1%. There are lots of questions about how well this would work. One is, can't Medicare beneficiaries already choose among private plans under Medicare Advantage? They can, and a quarter of them do. But Medicare Advantage wasn't properly structured to give full competition among plans. And our plan, we think, would structure the competition so that it actually lowered the rate of growth of cost. And people question whether there is evidence that competition leads to lower cost and better quality. Actually, despite its perverse features, Medicare Advantage provides considerable evidence that competition works. The impression that it is more expensive derives from the fact that Medicare often pays plans more than the cost of fee-for-service. But under our plan, that would not be possible, and the competition, we think, would hold plans down. Finally, would older and sicker seniors end up in traditional Medicare and raise its cost? This fear is based on the assumption that risk adjustment can't work and rules against cherry picking will not be enforced. But in fact, we believe that these rules can work, that they're working better in Medicare Advantage than they used to, and will work still better under a new system. We believe that health care policy is far too important to be driven by a single party's ideology. No matter how the 2012 election turns out, the President and congressional leadership should strive to find common ground on how to cover the uninsured, how to reform Medicare and Medicaid while stabilizing the debt. We believe that our plan contributes to that end. Thank you very much for giving me the opportunity.
Thank you very much. Mr. Anto.